Okay. So to start out, before we ask the panelists to join us in conversation, we do have a poll question that we wanted to start with today. And so our poll question is, have you completed your advanced care planning document, such as a living will and healthcare proxy? We'll give everybody a few seconds here to complete this poll question. Okay, we'll go ahead and end the poll and share the results. So we'll see that around 61% have said yes, that they've completed their planning documents. 36% have said no, and 3% are unsure. So I think that's really a good starting point, for our conversation today. So our first question, and I want to start with Eliza for this question. Recently you authored the toolkit that we're talking about today, LGBTQ plus Advanced Planning Toolkit. Why did you feel this guide was needed?
Thank you, Cheryl. Well, I want to start with part of my answer ties into the poll that we just did. So the population in this webinar is does advanced care planning at a higher rate than the average American, which is typically around 30%. However, we know from research that the average American, including LGBTQ Americans, are interested in advanced care planning at a rate of 80 to 90%. That is not matched with who actually is able to complete it due to barriers. Obviously, there are the emotional, psychosocial barriers within the healthcare system that are difficult for anyone who is interested in advanced care planning, but there are particular vulnerabilities that the LGBTQ population has, whether it's discrimination, historical and current, whether it's not having traditional caregivers in place. There are multiple barriers that the LGBTQ older adult population in particular is up against. We also know that this population is growing. We have about 3 million LGBTQ older adults currently in the United States, but that number is projected to be around 5 million in the next 10 years. So the growing need and interest is really indicator that this is an important resource.
Thank you, OSHA. I know I probably first started thinking about my own planning process when I was in my late 20s. And it was a result of the Terry Schiavo case in Florida that really made me kind of step back and think about, why is it important to have these documents? And, I really wanted to make sure that my family and my wife knew exactly, what my concerns were and what I wanted, towards the end of life, should that come into play. So, again, just really want to thank you for the work that you've done here.
Absolutely. That, the legal landscape is changing, and even if there are more protections in some states for same-sex couples, for different gender identities, that's changing all the time, and it's important to have these ironclad legal documents that can withstand these changes in the culture.
Thank you. So, OSHA and Allie, why did Compassionate Choices feel that this work was so important? And, why did you want to engage with Sage and Eliza in this work?
Yeah, and I'll just say that absolutely a big part of this is even just talking about the statistics that we see in our community. And as folks that are off in the field doing this work, we're regularly having conversations with people where they're like, I didn't even know or think about this as being something that was important and useful for me. But now I've seen it because I've interacted with an experience where someone's end of life wishes weren't honored, or they were just blatantly disrespected when it came to being in a hospital or being in a funeral home, because of discrimination and because of people making those choices. But also when it comes to actually having these tools, it's about being able to minimize those experiences. For me, I came into this work specifically with LGBTQ end of life care because of my last job having an experience where a coworker had a partner that passed away, and they watched as that individual's family swooped in and really took over and eliminated their community and their LGBTQ family from being a part of that experience. And that completely shifted my perspective on where the gaps are in our services and how important it is to really make sure that we're providing people with the resources and sitting down and really having conversations about what their values are and what they want to see and what they don't want to see when it comes to their end of life care. And the other thing that I think is so incredibly important about this tool is that it's intentionally meant to not be so overwhelming. Like a lot of the times one of the reasons people don't do this work is because it's like, oh my goodness, there's so many words and so many documents and so many spots on the internet that I can look and do research, and I just can't do it all right now. It's too much to think about, and it's already on top of the weight of just thinking about end of life. So they choose to take a step back and not come back to really filling out their paperwork. So I'm excited for this tool because it's not only cute and beautiful, which we love to see, and Allie, of course, can talk more about that, but also because it really is meant to be this guiding tool to just help people walk through just the foundational stuff and then have some prompts to really dig deeper on what your values are and how you can have these conversations with your community. So that's really why I feel like this is needed, and also why I'm so excited that a tool like this was created.
Thank you,
Thank
Osha.
you.
So Allie, you're supposed
Sure.
to tell us why it's so cute and approachable.
I know, I'm not sure where to start with that. I do love the colors and the graphics. It is very approachable. I wanted to add that Compassion and Choices has a long history of working with the LGBTQ community and being a part of the LGBTQ community and having folks on our staff who really understand the issue pretty acutely. And I think of some of our storytellers and even just like the LGBTQ icons that I can think of who have talked about death and dying openly without fear and without stigma. People like Audre Lorde and the Cancer Journals, people like Barbara Hammer, who was a Compassion Choices advocate, but also a prominent LGBTQ filmmaker. And those stories and the people who share their stories are so important to this movement. And they're kind of the reason that Compassion and Choices can continue our work with the LGBTQ community. So that's part of the puzzle here, for sure.
Thank you all. So for this next question, Osha, I'd love to start with you, and then we'll go to Eliza and Allie to round out this question. We often hear that we are facing a loneliness epidemic, and it's compounded from that intersectional place of LGBTQ plus individuals, maybe having what we like to refer to as thin social networks. And so oftentimes it's hard to discuss the topic of advanced planning with folks who may not feel that they have someone to really step in and serve as their healthcare proxy or their durable power of attorney for finances. So, in your experiences, how do you go about having these conversations and encouraging people to look more broadly across their networks for folks that may be able to really help out in these situations?
Yeah, absolutely. And that is a great, perfect question because it is easily one of the top questions that comes up every single time I'm doing a presentation with folks. And I not only say that just because of why I think it's so essential for us to talk about it today, but also because for those of you that are out there, if you're someone that falls into that same boat where it's like, I don't know who I would call on to be my healthcare proxy. I want you to know that you are absolutely not alone in that, because this is something that we see across the board with our community, and recognizing that that to me is a part of a larger issue with our society versus seeing it as something as like a personal failing. So with that being said, I also want to be honest about the fact that transparently, this is a difficult question because there are so many factors involved here. But what I do talk with people about is thinking outside of solely having this chosen family or someone that you can call up every single day to come over to your house or whatever. But really, to your point, Cheryl, thinking more broadly about what community am I in and who's around me at maybe an LGBTQ center that's close by or at least within the state. Maybe if you're someone that's religious or spiritual, is there a setting near you that feels comfortable to be able to go to? If you're interested in exploring more with death doulas or end of life doulas, is that a resource or service that you can seek out that's in your area, or someone that has services that are virtual that you can talk with? And I say this to talk about not only someone to be a healthcare proxy, but also as someone to just have these conversations with, because these are all avenues to seek out an individual that may be able to offer a service and say that I will be that person to speak for you when the time comes, whether, you know, you need have any sort of decisions around anything in a healthcare setting. But then also, if this is just someone to seek out to talk about, I am overwhelmed still thinking through what sort of care I want to receive and just thinking through death and dying. And I want to have someone to really sit down and have this discussion with, but I don't have anyone else in my circle to do that with. Is there someone at any of those spaces that can be that person with you? So those are really the top things that come to mind. And for those of you that don't know, death doulas are folks that are able to really guide people through death and dying, and we can find their services on just doing a nice little Google search, or, you know, asking some friends, or going to different community organizing spaces to seek out who might be a resource nearby you. But I know that Ali and I are both trained as death doulas, so that might be something that Ali would be interested in sharing more about too.
Thanks, Osha. Yeah, I think death doulas is a great example of thinking outside of the box when you're thinking about your healthcare proxy. And also sometimes the people closest to you, or the people who are like most deeply intertwined into your life, aren't the best people to be your healthcare proxy. And thinking about that and thinking like maybe a community member who can be more objective is the best choice for me. So definitely thinking creatively and thinking about personalities and how those personalities work in your life. I have a huge family, so I'm constantly thinking about the juggling act someone might play if they were dealing with all of the personalities that I do on a daily basis. So just thinking creatively for sure about who to appoint, and thinking outside the box is so important.
Absolutely. Thank you, Ali. And I'll just add, I think it's really important, as you both said, not to perpetuate the shame of loneliness and to reinforce the protections that are in place in the healthcare system for people who don't have or don't choose to have those personal supports as their healthcare proxies. I think some people come to the healthcare proxy as the first document in advanced care planning. They feel overwhelmed. They might not know who to choose. And then that feels like the end of the road of the conversation or doing advanced care planning to them, when really that's just the beginning. And that those are the times when you don't have a close personal community, when writing down your wishes is most important. When you write down wishes, it doesn't just have to be your close friend or your healthcare proxy, your partner who follows them. It's helpful for your physician, for your nurse practitioner to read, to understand, to see you as a person as well. So it's helpful for folks to know that it's changes state by state on what will happen if you don't designate a healthcare proxy, but typically it's two physicians who have to come to an agreement about choices for you if you're not able to speak for yourself, and them having a living will document of your thoughts, wishes, values, what's important to you, it's irreplaceable as a resource for them in doing right by you and your body. So that's what I would share about what folks who are worried about completing or not completing a healthcare proxy should think about, that it doesn't just stop with that.
I think those are all really good comments. And it also made me think back to a situation that I was in with an older lesbian couple who, had chosen healthcare proxies 20 years prior to them really needing someone to serve in that capacity. And when they revisited, the healthcare proxy and the decisions that needed to be made, it was decided that maybe they needed to change, who was making those decisions. Just because of being in same age brackets, that can, two 80-year-olds serving as powers of attorney for one another can sometimes compound, concerns around each other's health. So how often, I mean, do you recommend that people revisit and continue to have conversations about their choices, especially if they've named somebody, to make sure that, 10 years down the road, is this still the right scenario for us, or should we think about changing?
Absolutely. Both my recommendation to providers would be to bring this up at life changes, life milestones, changes in partnership, changes in family, having children, all of those changes, including health events, should be stop points to say, this is a living document. How have my values, how have my identities changed, and how does my paperwork reflect who I am as a person? And it's just not a closed book. It's a continuous conversation. It's an ongoing process.
Very good. OSHA.
Yeah, I just wanted to add that I hope that that also feels like a relief to people, where it's like, oh, I don't have to write this down or say this today, and then it's forever. And I can never go back and feel differently about a situation or where we're at, even with the world. So I definitely think that it's really important for people to be able to revisit, like you all said.
And I
Yeah.
would add,
Go
sorry.
ahead, Allie. No, please.
National Healthcare Decisions Day is a huge opportunity every year. They put it around tax day for a reason, and even people from Compassion Choices use the new year as an opportunity to revisit their plans, or even their birthday or Thanksgiving, or whatever feels right to you. I think it's important as you change to change your plans, and it's also important to continue the conversation just on a regular day. I guess because I work at CNC, but I love having these conversations with my loved ones, especially when it comes to just being honest with each other about our healthcare and about our needs.
Right. Yeah, and I also think it's okay if you've agreed to be someone's healthcare power of attorney or healthcare proxy. It's okay to reevaluate that too and say, is this still the right decision for me? And if not, I need to share with this person that maybe we need to reevaluate if I should be serving in this capacity. This leads right into the next question that we had for Eliza. Thinking about your background, especially within the healthcare field, is there a place for social workers, chaplains, case managers, doctors, nurses to be more proactive in working with folks on making sure they have these documents in place?
Absolutely. One of my favorite parts about working in palliative care is it's a truly interdisciplinary field and specialty. However, studies show that our schooling as nurses, for myself, as other healthcare workers, and training does not sufficiently prepare us for these emotion-laden advanced care planning conversations, not to mention the cultural taboos, the societal, social discomfort around these issues. So I think that a big barrier for my fellow healthcare providers is feeling like they're opening a can of worms and not sure how to deal with every single aspect of it. So the role that healthcare professionals can really have, any healthcare professional, from social worker to, like you said, healthcare providers to community advocates, chaplains. You do not need a lawyer. You do not need to be a provider to fill out a lot of these documents, healthcare proxy form being chief among them. So I would really advise, support, empower folks to do that primary palliative care, introduce the topic, refer to these resources, pull up the webpage of the LGBTQ Advanced Care Planning Toolkit, and ensure the basic ABCs of advanced care planning are in progress, introduced in the awareness of whoever you're helping. You don't have to get into that kind of unknown territory in order to just make sure that your client, your patient is prepared for emergency situations. Usually it takes about 5 minutes to complete that healthcare proxy form and stick it in an in case of emergency folder, all of which is reviewed in the toolkit. So that's the advice and support I would provide to our profession, our healthcare field workers, and just state also that my information is in the toolkit to reach out. I'm happy to provide additional personalized support as well.
Yeah, we also had a comment here in the chat to the hosts about this actually being a billing code now for doctors, so that they can actually bill during an office visit to have these conversations. And, I oftentimes think that when the conversation is had with a doctor or a healthcare professional, again, it helps to normalize this conversation. And it's a part of, the planning that hopefully isn't just happening during a major medical crisis, but is also part of our preventative health. And what does it mean to have these things in place early on? I oftentimes like to say it's never too early to plan, but it can be too late. And so we want to make sure that, these conversations are happening early and often. I also think this is a great time to take a question that actually came up here for the panelists. This seems to be heavily based on choices for people who have fairly substantial resources. What about members of our community who may not have resources? How do we help them?
I would ask a clarifying question. When you say this, what is the advanced care planning seems to be based on choices for people with resources?
I think that's what this question is getting to. Yes.
Thank you, Mary Ellen. So this is a great question because, advanced care planning, stating your values, preferences. I run into this all the time as a nurse practitioner. I ask people to tell me their ideal location situation of where they would want to spend their last days. And often with, as you're pointing out, Mary Ellen, the ramifications, the constraints of hospice care settings, of reimbursement, of caregiver options. The ideal is perhaps not what can actually happen in practice. So I think it's helpful to still know the ideal so that we can work towards that and create environments that reflect that even in other settings, and to do advanced care planning and so that, for example, I've had multiple situations where folks have had to move into nursing homes, and that has caused a recloseting and a denial of their identities or hiding of their identities due to fear of discrimination. While that is a terrible consequence, I think that having those open conversations with your providers for patients is a way to corral their path towards more inclusive environments, towards riders for nursing homes that state wishes. That's detailed in the advanced care planning toolkit. So I think there are some resources about what specific documentation can be done to protect identities, particularly for more marginalized communities. I hope that touches on your question, but it's definitely important to acknowledge that the financial element of this, particularly with insurance companies, is a difficult hurdle to overcome.
Yeah, I think also, and maybe OSHA and Ally, you may be able to speak to this as well. I think oftentimes people, question, do I need to go to an attorney, to an elder care attorney to have them draft all these documents? Or, are there things that I can do on my own that, doesn't require hiring an attorney? Because I think that's oftentimes where the financial barrier comes into play for folks.
Yeah, and I'm so glad that you brought that up because it reminded me too that in that resource section on this particular tool and then also on our CNC website, we include information around Free Will as a website that folks can utilize to really just have the templates for figuring out some of these decisions that they want to have. And to Eliza's point, this isn't necessarily always about having money. Like we think about talking through what happens to all of my things when I pass away, and it's like, well, I don't have a mansion, so who cares? Like I don't, then it seems like, oh, well, I don't have things, but it's like that's not necessarily true. So really being able to dig deeper to the fact that each and every one of us is a human being that should be allowed to experience an end of life that is at least thoughtful around what matters most to us. And that might, to your point, not necessarily mean having, the most expensive attorney helping through the entire process or going to the most expensive nursing home and things like that. But it's still having a discussion around what do I want, whatever the space looks like that I transition in to really feel and look and smell like. What sort of care do I want to receive from my community or whoever is there with me, based on my identity, based on what's comfortable for me and for my body. And then again, to my point too, thinking about other free resources. And I'll even throw another shout out to death doulas that sometimes that's an option that folks offer for free, sometimes on a sliding scale. So there are ways to be able to still do this planning that is free or is less expensive than I think we sometimes imagine it to be.
OSHA, I think you were describing the one of my favorite aspects of the toolkit, which is the My Caregiver, where folks can fill out their preferences and in kind of the exact format that you were discussing.
Could you
And
maybe, I was going to say, Eliza, could you maybe share a little bit more about that?
the letter.
Yeah.
Yeah, absolutely. So this is a letter. The blank version is in the back of the toolkit. It is something that that a patient, an individual can use for their home health aide, can use for their loved one as a caregiver, can use for their provider, their social worker, anyone who might be new to their care and they're just meeting them or reintroducing themselves with their preferences. It elicits answers about what the person likes to do, what their identities are, what their meaning of their life has been, what their spiritual beliefs are, as well as what medications have and haven't worked for them, what makes them feel comfortable and well in an environment. We get creative, as OSHA was saying, like what kind of lighting, what kind of appearance, what kind of physical touch. So these are all things that can really make a difference in someone's environment that aren't necessarily financial.
Thank you very much. The next question that I had, and we already kind of started talking about this, the whole concept of planning early and planning often. What are some of the challenges that happen if we haven't planned?
Yeah, I would say, like you said, we have touched on quite a bit of this. But the three things that always really come to mind for me when thinking about why proactively having these conversations is necessary is thinking about minimizing pain and discrimination, thinking about how do we allow for whatever our community, chosen family looks like to really be able to be in a space of really grieving. And then also, how are we creating a transition that is reflective of the life that we lived? So all of that are included in the ways that, to just the point that Eliza was making, we're really thinking about, okay, so going into vetting a funeral home or talking with the hospice or having conversations with medical providers to make sure that they're aware of our identity, our name, our pronouns, what burial looks like and means to me as far as the attire that I want to wear, the way that I want to be referred to, all of those things are helpful when we can have a conversation ahead of time, and then thinking about the hustle and bustle and the scrambling that can come during these stressful moments when someone is sick or something is happening or, just naturally transitioning through towards death instead of or a way of being able to alleviate some of that stress for our community is being able to have these conversations early. So now they're more focused on, okay, well, I know what they would have wanted because we talked about it. We've been talking about it to Allie's point. This isn't just a one-time 15 years ago conversation. We've been having these conversations. So now I'm ready to really help in this decision-making process and help with just making sure that we're meeting the values that we've already discussed they're interested in having and allowing myself room to really grieve and be present with them. And then also, again, lastly, just thinking about what proactive conversations can mean for us when it comes to just allowing for spaces of joy. And, so often we're starting to have this movement where more death workers are talking about how thinking about death earlier on gives us room to really enjoy life. And I think that that's so real. I will admit that that doesn't necessarily always feel immediately like the case for folks. So I completely understand that. But a lot of times we're living with this weight of the end and this weight of, I just don't know what's going to happen. I don't know what it's going to look like. I have all these questions. I have all these thoughts. And instead of really going headfirst into processing and dealing with that, it's like, I'm just going to keep pushing it off. So then it becomes this larger looming cloud over me. And so I think being able to, have these conversations proactively is one of those ways that we can help with alleviating some of the discrimination that comes up and minimizing those experiences for us so that people have already had discussions around us and our identity and our values. And we've already done the vetting to figure out who's actually a good provider and location for us. Allowing room for our community to really be more present in our grieving because they're not scrambling for the answers, and overall just allowing for ourselves to be able to actually have an end of life experience that is more focused on our values because we've already had that time of reflection and really figured out what that would look like for us.
Eliza, Allie, anything else to share there?
I think that's a perfect answer, Osha. So thank you for that. I would just add, I think over my time at Compassion and Choices, I've seen so many stories of things that went wrong when plans weren't in place and the kind of pain that caused people who come to Compassion Choices to tell their stories in order to avoid that happening to someone else. And that beauty of fighting for someone you don't know, whether it's in your family or in your community or just in the country and at large, I think is so amazing. And my hope would be to flip that, right? So that people come to tell the joyous story of what happened when their family did have this conversation or when their wishes were met. And of course, we're not there as a country, as a society, but we can kind of chip away at that. And that's kind of, to me, the point of this toolkit is to chip away at that that kind of struggle and really take that fear away from these conversations.
Absolutely. echo what both of them had said. I think thinking of it as a gift to your loved ones and to your providers to mitigate their stress and the work that they do in the event of a health emergency. I've had multiple patients, family members tell me there's no greater gift. And I think that the other piece of it is that of course, we can't prepare for, expect, we don't know the future. We don't have a crystal ball of every possible thing that could happen. But there are some common health emergencies that we can all consider and prepare for. It's not going to be a blanket, but it's helpful to know a few things, to think about a few outlined options that are listed in the toolkit, and that your healthcare provider or any other provider, social worker, community member, chaplain can speak to. It doesn't have to be all about the medical ins and outs of intensive care. So I think just thinking of it more broadly than any specific difficult conversation. I'm just reading a question. The POLST is covered in the toolkit.
Eliza, could you tell us what POLST stands for?
Yes. POLST or MOLST is medical orders for life-sustaining treatment, or physician orders for life-sustaining treatment. That's a state-based document that kind of prepares for those, like I said, particular more common medical situations that we can all expect to come across in one way or form. Resuscitation, intubation, intensive care, and hospitalization, as well as use of certain medical treatments such as antibiotics, fluids, feeding tubes. So it's a brief 2-page front and back form that's helpful for folks with advanced illness who are making those pre-designations.
Thank you for that.
And it does need a physician or provider, nurse practitioner signature. So it just does need to be done in a healthcare setting, unlike the healthcare proxy form, which can be done with any 2 witnesses.
Okay, very good. Couple of things. There was another question. First off, if you joined us late, there will be a recording of the full webinar, and you'll be getting an email tomorrow that will provide a link to the website where the recording will be, as well as a link to the toolkit that we've been discussing here today. But we do have another question, and I think it's always worth just reiterating. If someone feels like they don't have someone to serve as their healthcare proxy or the executor of their estate, what recommendations do you all have? Where do they start?
Yeah, and we discussed really being able to think more broadly and more creatively around what sort of resources are in your area, like an LGBTQ community center, or if you are someone that is religious or has a spiritual connection, if there's a setting like that near you, or if you're interested in being able to seek out a death or end of life doula that might be able to offer services like that. And again, one of the things that we talked about too was whether that is 100% guarantee of this person being able to be a healthcare proxy, or if that's also just being able to have someone that can have these conversations with you too. And also, Eliza, you made a great point too that I really appreciated about having this information going to your medical team as well, even if they're not necessarily the healthcare proxy, just having them be aware of what your wishes are.
Thank you for that. Our next question is: advanced planning is often difficult. It's difficult to get started. So for anyone who hasn't started the process, do we have to do it all at once? Or is there one specific form that you would really encourage us to make sure that we take some time to think about and go ahead and start that planning?
Yes, as we've we've referred to the healthcare proxy often. This I believe to be, I think it's accepted to be the most important medical document, not only because having a person who can speak in more color to your preferences and in more specifics based on unknown situations that can happen in the future. We can't write down every single possible thing that we would want. So having a human that can speak to those situations, I think, is most helpful. So having that healthcare proxy form done. There's also on the healthcare proxy form about 2 or 3 lines where you can write down your living will, which is space for your preferences, limitations, and instructions for your care. You can even attach a piece of paper to that healthcare proxy form with a more detailed living will if you choose to. So the healthcare proxy form, as listed in the toolkit, is the #1 form that I would recommend for anyone, even if your healthcare proxy is already your spouse and that's recognized in your state. It's still helpful to have that healthcare proxy form. You have the opportunity to list your preferences, and it's an extra support in a difficult and changing political environment that we're in.
So this is not related to healthcare, it's more related to after death wishes. But sometimes I find it helpful to think about, your memorial service, your funeral, what happens to your body, these pieces first. Like, it might not seem totally linear, but I like to start with the question of what song would play at your funeral, and starting to think about what it would look like when you're no longer here. And starting there in that place of your legacy, and what you want to leave behind, and then kind of working backwards towards, well, what are those last moments of my life going to look like? What do I want them to look like? What do I want them not to look like? That's kind of helped me. I mean, I've found it daunting in my own personal life. So going back to this idea of who will celebrate me and think about me is kind of comforting. So sometimes starting there in that after death space is helpful too.
I really like that idea, Allie. It brings me back. We lost my aunt earlier this year, and when I arrived home to be with my family, they had already, gone to the funeral home, and my aunt had a 4-page set of instructions on what was to happen. And so there was really no question. The family knew exactly what song she wanted, the fact that she wanted me to sing. Now that I had to practice because I didn't know that that was happening. Um, but it just really helped, I think, for the family to know that my aunt had all of her wishes written down and there was no question. So they just followed the directions, that she had left. She had also like sketched out what she wanted her headstone to look like, and it had actually been put in place several years prior. So just all those little things that she was able to take care of and really had ownership in, and that really helped, as the family went through the grieving process.
That's beautiful. Thank you for sharing that, Cheryl. And I just love that too when thinking about what Eliza said earlier around being able to give that as a gift of peace to, her family. So that's wonderful. And I also want to add to the question to just even thinking about other ways to have as these little reminders or little times of reflecting on your values or what makes sense to you. I have this little death deck on my desk always, and I bring it to a lot of presentations with me. And in this one, actually, as I say that out loud, is the end of life deck, but they also have a death deck. And those are just a couple of fun cards for folks to be able to look through. And like I said, you can go through maybe 3 a day or a couple a week or, whenever it really makes sense to start having those reflection questions, to Allie's point, that really pinpoint. I've never really thought about the specifics around what I value in a funeral or in a hospital setting. So
And I just opened up our Q&A, and I don't know if the other panelists have looked yet, but we have 5 questions waiting for us. So I think this is a great time to go ahead and open up for some of the questions, and we'll continue to have this dialogue. The first one comes from a person who says that they love the format of the toolkit and ask if it's available in hard copy for use in presentations or group education gathering. We have not made it available in hard copy, but we do encourage folks to download it, share as needed, make copies if you would like to. And this also is from an end-of-life doula. OSHA, Allie, Eliza?
Yeah, that's great. I guess I'll share that I am in the works of being able to figure out what it could look like for us to get a hard copy version of this out for folks. Obviously, that means some fun transitioning and formatting and all that sort of stuff. But that is a discussion that we're having because I recognize that for some of us, it's really nice to have it on your laptop or whatever. And sometimes it's nice to have it on paper and writing everything in. So please, thank you for that question. Stay tuned for what that can look like down the line. But obviously, to Cheryl's point for now, just being able to print it out.
Our next question, not all states have mental health care wishes, powers of attorney, similar to a physical health care plan. Does our toolkit have such a plan for mental health?
So because the toolkit is national, we don't get into state by state specifications specifically. The toolkit acknowledges the use of extra pages on a standard healthcare proxy to write down wishes that might be specific to mental health. And it also points to working with your mental health provider or your primary care provider to perhaps look at what other states are doing and make those specifications that are then signed by 2 witnesses, signed by your healthcare provider to legitimize them for future use. So like you said, state by state, it's very different. And I think just working within the guidelines of what the states are giving us and making our wishes clear on an extra piece of paper so that our providers can follow our preferences.
Thank you, Eliza. The next question, and any 3 of you can chime in on this question. Do you know of any resources for LGBTQ plus widows, such as bereavement groups? And I will say this is a question that we get often at SAGE, and there I do tend to see a lack of bereavement groups that are specific to LGBTQ plus elders. So just wondering if OSHA, Allie, have you all seen anything?
So the first thing that comes to mind is thinking about groups like the Queer Community Death Care, Queer Death Collective, and Queer Grief Club. So all of those are groups that offer national, virtual, sometimes in-person spaces to come together with other folks that may just be thinking about grief and also thinking about what end-of-life wishes can look like for them. That's not necessarily specific to being an LGBTQ partner that lost a partner, but sometimes those conversations can also be more specific in those ways too. So I would look into those groups, and I am absolutely a rabbit hole researcher. So sometimes that can mean like, oh, well, I found this, and that'll lead to another group that may be more fitting for you or more like specifically fitting for you. And the other thing is absolutely just being able to think about if there's any local groups and organizers that are doing work, and if that's on a meetup, if that's at a center group page, if those are all avenues that might make sense to go, or if starting a death cafe makes sense for folks. And for those that don't know, a death cafe is really just a space for people to come together, eat, have a meal, and sit down and talk through what death and dying looks like for them. And sometimes those are guided with questions specific as prompts, and sometimes it's more of an open space to see what's coming up in that moment for people.
Thank you for this question, Kenneth. So again, this is a national guide, so a lot of these support groups or I did not find any national support groups. And so the page 22 of the guide talks about bereavement practices. I did in my research find local LGBTQ centers or senior centers that had bereavement groups. And even I reached out to one in White Plains. I live in Manhattan, so it was nearby, and just asked them, their bereavement group was on Zoom. Would they allow for someone outside of the area to join their bereavement group because of lack of local resources? And they said that they would. So this is, I think you do have to get a little bit creative with it, like OSHA was reporting, and do some Google diving. But that was my experience with reaching out to another town's support group, and a lot of these resources being on Zoom since the pandemic, we can join them virtually.
Yeah, when I get these requests at SAGE and through the National Resource Center, I also encourage folks to check with local hospice organizations. Oftentimes they are very LGBTQ plus welcoming. And while they may not have an LGBTQ specific bereavement group, oftentimes are very open and welcoming to supporting LGBTQ plus people. So I would always, encourage you to reach out to those groups as well. And our next question that came up, I see Eliza is typing, but I think we could also respond to that question live. Where should we store these documents? They're created, now what?
This is one of my favorite questions because the answer is quite funny. The best place to store them is in the refrigerator or the freezer. All of my grandparents, I'm lucky to have 3 of them, have a medication vial that they have rolled up their documents into, and it's in the freezer. You can put it in a plastic bag, a Ziploc. The reason that we recommend the freezer or the refrigerator is because most everyone has a freezer or refrigerator, and because there are not other papers in that place, it is easy to find these documents. If you put it in a file cabinet, if you put it in a bedside drawer, it often gets lost, misplaced. So having those documents either on the fridge, magneted onto the fridge, or within the refrigerator in a plastic Ziploc bag, that is actually the first place that the EMTs, paramedics, fire department will look if they come into your home, and is an easy place to say to your healthcare proxy, to your neighbor, to your friend, look in the fridge, you'll see it. It's the only paper in there. Making sure though that you make it so that it won't get frost or by ziplocking it. Yes.
Thank you for that, Eliza. The next question, and I think this is one for OSHA and Allie. This person says, I'm interested in medical aid in dying. I'm worried that I may engage an elder attorney who is opposed to it. What if the hospital I go to is morally opposed to medical aid in dying? Or do you have any recommendations, Allie and OSHA?
Yeah, that's a great question. And the reality is that this is another point of having these conversations earlier so we can really get matched up and paired with individuals that are going to honor our wishes, including things like medical aid in dying or voluntarily stop eating and drinking, and different options that come with end-of-life care. And my recommendation would really be to Well, first, I want to say that because of so many factors, hospitals that are not interested in honoring medical aid in dying is something that's very real that we're seeing in a lot of locations. So being able to seek out another hospital nearby isn't always accessible for folks. But we do actually include on our website a guide that folks can fill out around being able to get transferred to one that will honor those wishes. But again, that to me means being able to really have a conversation beforehand, and find a doctor and say point blank, like this is something that I'm interested in. Are you interested in that? Do you know someone that would be the best person for me to have this conversation with? Is this something that you're as familiar with? Is it worth being able to really sit down and have a conversation to see if you're just not as aware of it as being an option in our state? And it would be meaningful to really discuss changing that perspective. So that's my first response for that. And for those of you, I should have started with this too. For those of you that don't know, medical aid in dying is an option for folks that are terminally ill in certain states to be able to utilize medication to end their life if they have a 6 months or less prognosis. And this is really being able to allow folks to be empowered towards having an end that makes sense for them and is alleviating a lot of that unnecessary pain. So that's my initial answer to that. Allie, is there more that you want to share with it?
Osha, it opens an interesting thought for me because, as you're thinking about your healthcare provider and your LGBTQ, you should, or I will use I statements. I would also be thinking about, if that person will honor my wishes as a queer person and honor my pronouns and honor, how I want to live out the last days of my life in that way. So I just was thinking about that kind of natural connection. Between our movements and yeah, I think it's important to have those conversations early with healthcare providers about end of life options in general and also just about the care you want.
Yeah, but I am happy to talk more with folks because when I'm being honest with myself, I'm like, that is a rabbit hole question for me that I can go on about and answer in more specifics. So if anyone wants to reach out, we do have our information attached to this tool and the information that will be coming out to you all. So knowing that whether it's me or talking to our end of life consultants who offer more specifics around your state and more of the needs that you might be having.
And I think along these lines, OSHA and Allie, I can imagine there are oftentimes difficult conversations to have, especially with family and our loved ones. Do you have recommendations on, if somebody and not even just medical aid in dying, but even like uh, opting for hospice care? Those can oftentimes be challenging conversations for families. So, if somebody knows that they're going to be having these discussions and they know it may cause a lot of emotions within the family or within their friend circle, are there recommendations for groups that could help with those conversations? Again, I'm thinking end of life doulas um, may be very instrumental in helping to have some of those conversations. So just thought I'd ask that question to you all.
No, that's a really good question. And to that point, that also is a great way of being able to share to folks too that end of life doulas, death doulas, they're not solely for the individual, right? It's also about being able to have that guidance with the entire family. And sometimes these are folks that are coming in beforehand or holding hands with people as they're passing away, or sometimes it's about being able to make that transition once someone has passed away to really figuring out what are the next steps? How are we managing? How are we coping? So I definitely think that I can't sing enough praises for the work that death doulas do. And also, again, to really the point that Ali was making earlier, when it comes to having these conversations with our community, I've heard so many people talk about it in so many different ways. People that are like, I set everybody down, I gave them the workbook, I was like, we're gonna be here for an hour, let's talk about it. People that turn on a movie that includes someone passing away and afterwards really bring up casually a debrief on, if I was in that situation, this is what I would want. This is what it would look like for me. Or people that are really, again, just gathering around with a meal and opening it up to just talking about what are each of our values, and then leading that into a discussion around how that shows up in death and dying. So your community best, um, folks that need a firmer introduction to this conversation and folks that need more time to really process and have a softer approach to it. But this tool can most certainly be a way of being able to guide people through that conversation. And a lot of the resources at the end can also help with that.
I also think, it's kind of like asking for help, right? You think that you're putting a burden on someone, but when you end up asking, they're kind of thrilled to help you. I think it's a similar energy of it's an honor to be asked for help, and it's an honor to be asked to think about these issues for yourself or for your loved ones. And like we were talking about, it's a gift. So if we come at it from that place of compassion and empathy for everyone involved, I think you can't really go wrong in those conversations.
And just to point out that in the toolkit, there is a question and answer how to ask someone to be your healthcare proxy, which I think can apply to other aspects of advanced care planning as well. So it just gives you specific language for how to discuss these difficult, weighty topics with your loved ones and hopefully make it approachable.
Are there any other questions? I know there was one, I think, Liza, that you had answered in the chat that not everybody saw. And this
Yeah.
was a question about should a person go ahead and complete an advance directive even if they don't have a healthcare proxy?
The answer is yes, especially if they don't have a healthcare proxy, actually.
Do you want to say why?
To reiterate, because so that they're in many states, not all, but many, if someone does not have a healthcare proxy and is what's called unfriended, which means not having someone from their personal lives or communities that is going to speak on their behalf in the event of an emergency when they cannot speak for themselves. Two physicians from the healthcare organization that they're being cared for in will determine the next course of action, their decision based on what they know about the person. Obviously, if they have a living will, specific documents stating what the person's preferences are, that is the best case scenario for those two physicians to make decisions based on the person's wishes. If that document is not in place, the physicians make their decision based on conversations with people who knew the person, other indicators of what their wishes were. But having those advanced care planning documents in order is most helpful for the person and their providers.
Thank you so much for that, Eliza. In our remaining time, just going to go back to the panel. Is there anything you wanted to share today that you weren't able to get to in our questions, or something that came to you that you wished you'd had an opportunity to talk about?
I think we really covered everything that is highlighted in the toolkit. It is long, it's about 32 pages, but I think like OSHA had touched on, I think we really break things down into step by step, hopefully not making it too overwhelming, making things approachable. And I would love to just end with the quote that I end the toolkit with, which is a book called The Beginner's Guide to the End by BJ Miller and Shoshana Berger. The quote is that our advice is just this: participate. Resist the notion that you have total control. Resist the notion that you have none. However you can, with whatever you've got, participate in your care, in your dying, in life. That really speaks to me. I think that it's overwhelming to think that there's no control, that we can't do anything, and that it's overwhelming to think that you have to do every single little thing in order to make things go right. And there's somewhere in between. I think we can all find that sweet spot for ourselves, for our loved ones. And the toolkit, I think, gives us the tool to do as much or as little advanced care planning as we want, but just to participate at least a little bit. So thank you so much for all of you who came and participated and are interested in this topic. And
That was the most beautiful way to end it. I think you did wonderful. Thank you for having us be a part of this process.
Thank you, Eliza, and thank you, Sage. I love the toolkit and I'm excited to share it today. So thank you.
Thank you all for participating. And I do want to share in the chat box before people leave us today, my email. Feel free to email if you have follow-up questions that, come to you after the webinar is over. We're happy to get those questions back out to Osha, Ali, and Eliza and make sure that we can answer the questions for you. Again, tomorrow you'll receive an email in your inbox that will have a link to where the recording will be, as well as a link to the guide. I apologize that the National Resource Center website is down today. And, we're working with our provider to get that back up and running. But we will be, making sure that all this information is available to you. We'll also be looking through the questions that were posed by everyone today, as well as the resource links that have been shared. And we'll probably go ahead and develop another resource page just for the information that we've, brought to light during the conversation today. With that, if there's no more questions for our panelists, I'd just again like to thank you all for joining us, and a special thank you to Eliza, Ali, and Osha. It's been a pleasure to work with you all on this project. It's a very important, document that we've been able to really bring to life here. And, just look forward to seeing how this information continues to really help help the LGBTQ plus community as we think about our own advanced care planning and the planning of those that we love and care about.